We're losing one doctor a day. Psychological safety is at the crux of any healthcare workforce well-being programming.
If we can't love ourselves, how are we going to love somebody else?
By actually putting ourselves first, we are putting the patients first.
Can we go deeper with an example? Welcome to Push Yourself Podcast. What does it mean to lead with care? Not as a slogan, but as an organization. I've worked inside healthcare for long enough to know that wellness, it's not just a poster in the break room, it's lived or it's lost. Jeremy Segall is the Chief Wellness Officer at New York City Health Hospitals, but that title barely scratches the surface. This is someone who understands that healing has to start inside the walls of the workplace. So, Jeremy, I like to begin with the first question to move away from the labels, professional titles that we have. And I want to ask you this simple question without saying the word hospitals, wellness, or healthcare. How would you explain what you do?
I think the first thing that I would say that I do just as a human being is try to leave anything that I have come in contact with, whether it's a person, an experience, or a project, better than I found it. And in order to do so, to ensure that I respect the dignity of all that are involved. I think what I try to represent and model for not only NYC Health Hospitals, but in my own personal life is shared decision making, mutuality, reciprocity, ensuring that people can feel seen, heard, and respected and honored in terms of any input that they have to provide for projects, strategy, that their voice is not just welcomed, but is encouraged. And that I try to create a culture of acceptance and understanding based upon respect of the individual.
Wow, you've said so much. It's like I don't know what to kind of attack first, so to speak. Well, if focusing on compassion, focusing teamwork, and combining that with what you do specifically, yes, your title, Chief Wellness Officer, why is that all of that important in the workplace? I think this is applicable to any organization, but why do you think this is important specifically in healthcare and health and hospitals?
Well, I think honestly, healthcare itself has perpetuated stoic, silent, and stigmatized culture. We're often told that we are only effective or productive if we are trying to burn ourselves out, because the more we do means the more value we demonstrate or uphold, especially in an insecure or destabilized economic time period in the world or in the nation. And so I believe that by practicing humanity and humanness, authentic experience, that we are combating that stoic, silent, stigmatized culture of trying to be superhuman or to be seen as a robot or invincible or not susceptible to the same failabilities or adversities that populations that we serve experience as well. What I've seen not only in healthcare, but nationally, even across industries, is that we're told a leader must keep to themselves, not share their emotionality or their personal experiences, that we can't talk about this in corporate environments in terms of how we're having a tough day or a tough life experience, because then people won't respect us for who we are, what we're here to do, functionally speaking. And so I believe that my approach to this idea of courageous, compassionate approaches to culture building, but also embodiment and role modeling, it allows people to actually just be more themselves and to be more personal in their approach to projects or other people or peers that they work alongside of. So I truly believe that we can combat this idea of perfectionism or that we have to be a superhero by helping people understand that you can have a tough day, that you could have a tough month, even a tough year, but still be exceptionally impactful and effective in your work, as well as productive, even if you're having a tough mental health day or physical health day or spiritual health day or even social health day. So I believe that this idea that if you can really just embrace more of who you are and allow yourself to be vulnerable with conviction, to be more transparent in terms of your emotional experience, that ultimately strengthens who you are as a leader, but who you are as a teammate, and also who you work for would only be strengthened as well.
Now, that's a lot of great work, but I love to get into the specific whenever possible. Can you share some of the examples, stories, of course, understanding of HIPAA and all the relevant private information, but what have you seen specific examples of the impact of the stoic culture and also at the same time implementation of the work compassionate care work that you're doing, the successes that help to overcome that stigma and that, I guess, that old style culture with what you're doing as a chief wellness officer?
Without getting too grim or too dark in this discussion, some of the examples that I continue to see happen all across the nation is that we're seeing a perpetuation of and sustainment of the astonishing and staggering statistic that we're losing one doctor a day to death by suicide across both the public and private sectors of healthcare. And this is the healthcare landscape at large, not just at NYC Health and Hospitals. And the truth here is that we are seeing lives lost, and that we have lots of data to show that physicians are dying by suicide at an alarming rate compared to the general population. Especially if you're a female identifying physician, you're over 2 times more likely than the general populace. But we're also starting to see more national data saying that nurses are following, that social workers are following, that EMT or other emergency workers are following this. So it's not just in my own backyard of NYC Health and Hospitals. We're seeing this as a national epidemic. The other thing I want to speak to, which is also statistically evidenced by longitudinal studies, specifically by the Center for Disease Control, they published a study or research project about 2 years ago now, which has fully evidenced that healthcare workers, again, both public and private, all different care settings and service lines, are having an epidemic of poor mental health days. What they are reporting is that out of a 30-day calendar month, healthcare workers, compared to other industries like food and beverage and tourism and tech, as well as other essential workers, including fire department and police officers, um, we're seeing healthcare workers themselves have 5 poor mental health days a month. So we're seeing in other industries and arenas, intentions to stay working is increasing. So that means turnover is reducing, retention is increasing. Um, we are seeing in the healthcare landscape that still is a challenge, that we are unable to replenish the amount of healthcare workers that are leaving the workforce. And this is, again, not just an NYC Health and Hospitals issue, but a national challenge right now, that we are losing our seasoned legacy employees with 20 plus years experience, and we're losing employees between their first and third year faster than we can replenish it. And so this is happening all across our nation and across healthcare settings. What we're also seeing, unfortunately, continue to take place is that people are not just leaving their health system. They're not just saying, I'm going to go from this public institution to a private institution. They're not saying, well, I'm going to go from this one hospital in the same system to another hospital. They, with hundreds of thousands of dollars worth of student loan debt, are actually just leaving the workforce completely,
Wow. Oh,
pushing themselves away from their own passions, leaving the reason why they chose healthcare in the first place, forgetting what they love about the work that they do or why they stay working in it despite the many biopsychosocial spiritual stressors. So the evidence or the examples of the experiences that I am seeing are mirroring what's happening at the national narrative level right now. That could be the bottom, the underbelly of healthcare completely dropping out at any given moment in time. And why is that? It's related to burnout. It's related to toxic levels of stress in terms of the density of the stress that we're experiencing, but also the cadence and the consistency of stress that we are experiencing as healthcare workers.
when you were talking about stoicism, the stoic approach to work, to me, that sounds like a reflection on potentially kind of generational issue with the older workforce, if I can call it that, and the incoming Gen Z millennials who have simply a different attitude. And maybe this is just those two generations clashing with their approach when they have to work side by side. So wellness teams at health and hospitals, what do you empower them with? What is the approach to go out kind of there in the field? What initiatives do you implement in order to make the workplace, I guess simply I want to say, bearable and enjoyable potentially to work in?
I want to say there's a difference between wellness, happiness, and satisfaction. right? Psychological safety is at the crux of any healthcare workforce well-being programming or wellness strategy to help someone be on the journey towards wellness. Wellness is different than well-being. You can be in a state of well-being despite adversities and challenges. It's about how do you bring it closer to yourself in any given moment in time. And most people think that wellness is this picture perfect experience of being happy all the time. It's not, which is why I shared that earlier. The truth here is we have to define what wellness is, how wellness impacts or affects us, and how that further perpetuates pro-social or positive behaviors that continue to sustain our own well-being as we continue to strive for holistic wellness. Now, in terms of this idea of generalized statements about generativity, and what I mean by that is if you are a baby boomer, are we saying that you are any differently able to talk about your feelings or to understand the impact or effect of what happens when you don't speak about your personal experiences? No, but every generation, just like I am, just like you are, we are a product of our environment. We're a product of the national and international culture that is shaping us to be who we are based upon the needs of our family structures, of our financial stability, and what's happening all around us. And so, yes, we do see that if you're a baby boomer, you're going to focus your efforts and interests on different goals, on different expectations, versus a millennial or even someone that is Gen Z. But we all have the human opportunity to further validate our experiences and to be valued because of those experiences. But we have not been able to have the pathway to be given permission to feel safe to do so. So we are definitely seeing some of our more younger, in terms of age, healthcare worker populations be more open to discussing mental health, their own well-being, and are prioritizing that just as much as title and salary and other benefits in terms of the culture that prioritizes wellness. But that doesn't mean that a baby boomer also doesn't see the value of it or can't engage in it in the same manner. And can it sometimes offer clashes? But yes, everything can clash at some point in life if there's a lack of acceptance and understanding. So we just have to understand who we are as people, how we approach things, create environments that enables us to level the playing field, to diversify schools of thoughts, approaches to communication, and expectations of self in our work roles, but also in our personal roles within our own lives. And how do we help people feel safe enough to share their personal experiences, but to find the universal truths, the collective commonalities? No matter who I am a privileged, cisgendered white male. I absolutely have a very different experience from a Black trans female healthcare worker. I have a very different experience than others, but that doesn't mean that even though we have very different walks of life and life experiences, that we can't come back down to the common experiences that we do have. You know, when COVID-19 unfortunately struck not only at New York City Health and Hospitals when we were the epicenter of the epicenter, and New York City at large, but our nation, it was an international experience. So
Right.
we were all having a collective traumatic experience that we all had to work through the uncertainty of. We all focused on it differently. We all approached it differently. We all processed it differently. We all had privileges differently in that experience of COVID as well, but we all experienced it. So how can you find the thread?
Yeah, I certainly feel kind of unqualified, but I do hear a lot of things that speak to the heart. What I mean is the point of what we're doing here to me is to go, yes, beyond the labels, beyond the titles, but also into that experience. I think what you're talking about. I find that in sharing, being vulnerable is not just about sharing, but realizing if you share something, you can get hurt. I've learned during some of my recent conversations, and this is why I wanted to speak with you and other individuals who will bring that myriad, the wealth of experience. For example, I find that individuals who work in service based, working with people, I guess the kind of work that you do, more often than not in the stories that I have heard, they come from a place where they're trying to potentially fix something that happened in their past. And I'm going to get a little bit more specific. So, for example, myself, like, what's the seed for this podcast? Well, this is an outgrowth for me of my experience being lost after college, having that pathway of being wanting a job, getting into the field, and realizing, oh, this isn't it. This is totally not what I wanted it to be, what I thought it would be. And this is kind of in a way looking back, trying to find my pathway. I've stumbled into this field of training, human resources, talent acquisition, and find myself starting this project where I hope to pull in a lot of experiences. So I want to focus deeper with you because you're definitely passionate about the work, but I would like to bring it down from a very strategic overview down to you. What experiences in your past make you so passionate about the work that you're doing?
Yeah, it's a great question, and I think it'll tie nicely into to your prior question about what interventions or initiatives or projects are we doing to create more well-being. Um, you just spoke about the hardship that you've had after college and trying to potentially find your path, find your voice, or find your purpose. And so that's part of what we have to do in wellness is help people differentiate this idea of the life that they're supposed to be living versus the life and experience that they are. How can we help them connect to their true lived experience in the present here and now and understand that it is and or potentially could be hardship, adversity, fear-based, or actually cause us true distress, dysfunction, or even disorder. So it's the point of wellness to stop perpetuating the idea of us living this perfect image of what we had hoped and to reject the reality of what we are experiencing together. And so it's further ownership of your story, of your experience, and the empowerment of connecting to that in an authentic and vulnerable manner so that you can then use that information to create concrete steps forward with greater understanding of your own needs and wants and desires and what you deserve in order to further fill out your own wellness journey or to help bring closer to your well-being moment. And so, yes, I'm very passionate about this. A lot of NYC Health and Hospitals wellness initiatives truly are us saying we don't have to remain superficial. We don't have to just be on the surface. We don't have to live in this tiny box that sometimes we put ourselves in. That the limitations and restrictions of how we talk about ourselves in years past, not just at NYC Health and Hospitals, but I think in just corporate America, was that that's not professional, right? But the truth is, we can't split who we are personally from who we are professionally. And what's happening to me outside of my personal life is absolutely coming into who I am as my executive administrative self, my clinical self. So we have an opportunity to stop putting the veil on, putting the mask on. We have an opportunity to help someone really look in the mirror or become someone else's mirror to say, see you, I hear you, I acknowledge you. And that in turn can actually help them further connect to their true experience, which can help them identify what their needs are, that they can bring closer to themselves or ask support with from others so that they can continue to stay working in something they love or to continue to engage in their life more fully. So the initiatives at NYC Health and Hospitals are emotional and psychological debriefs, which are compassionate collegial conversations that open up transparent emotional conversations with each other that are facilitated in a contained and safe manner so that a staff member can hear their own experience, see themselves, and then greater understand what they might need. And if they don't know what they need, to have someone walk alongside of them without judgment or criticism to share greater resources with them so that they can one day find that answer and to feel
Can
less
we
in
go
that.
deeper a little bit into that with an example? Of
Yes,
course, without names.
yes, absolutely. I can give you patient experience examples, or I can give you personal examples. One of the breaking moments, if you will, of us choosing to evolve the Helping Healers Heal wellness program at NYC Health and Hospitals was we were focusing so much on patient care challenges, or what we call second victimization. But as we were doing a quality assurance approach to really understand what our program was really addressing earlier back in 2018 and 2019, we were not actually talking so much about an unanticipated patient outcome or event, or what we call a sentinel event, if harm reached a patient, or if even if we did everything right, it still didn't have the outcome we'd want for that patient or their loved ones that were seeking or supporting care of another. And so one day we get a debrief request around someone on a labor and delivery unit. It was a nurse that had been working for our system for over 25 years that was recently diagnosed with stage 4 breast cancer. And it was their last day at work. And they were requesting what we call a group debrief. So, what I was just talking about, that collegial, compassionate conversation, but it's done with a group, not just an individual. And all of this is always private and confidential, completely safe in terms of sharing. It's never used in any aspects outside of that collegial dialogue. And so that's an example, right? How did we help a clinical team on a very important service, which all of our services are important, but as we're bringing life into this world, how do we make sure that our nurses and our clinical treatment team members that used to work with this individual for almost 25 years could process the experience that this person was their last day and it potentially would be one of their last days on this physical or spiritual plane? And so, how do you process the mourning and grief of a staff member that was their work family for many years? But then, how do you also then process what that kicks up for you? What if your mom also had breast cancer and died, and that's now kicking up a behavioral reaction or a trigger? And how do I help a staff member respond to their emotional or psychological experience or some of their past traumas or something that has been unresolved with them or that's impacting them and affecting their ability to show up for themselves or show up for their work life? So that's just an example. We talk about these things in our wellness programming within the Helping Healers Heal framework. We talk about what happens in one of our level one trauma centers when an adolescent is wheeled in on a stretcher with 7 bullet hole wounds, and that patient looks exactly like that emergency physician's son, and what that then triggers within them, thinking about my son is also out here walking the streets of New York City and could be potentially engaging in experiences that could cause him harm. And so we talk about the experiences of what is going on within their head or their heart or surrounding their soul or spirit, and how that affects their behaviors and their ability to move forward through those experiences.
I think what you said just a moment ago, the talking part, I think it's underemphasized. I think, yeah, this is the point here, this conversation, you getting this message out, the sharing of these experiences is that, this is me being vulnerable to show that, I'm human. Like, I'm thinking of my parents who are from USSR baby boomers in that respect. And I'm youngest of three, but I could think a few years back, like in the beginning of COVID, my brother, who was living over in Ukraine at the time, passed away after an accident, and I could see how my mother's reaction. She did not have the tools to process that great big depression, constant grief. And I'm not saying this is not something that should have happened, but I would think this is just, there had been no way to bring her out of it for years. And this just tells me a parallel. If there's one person feeling this way, we're all, there could be another person undergoing a similar trauma. Of course, people die every day, but this is just the reality of life. But people simply don't have the tools sometimes to process it. Not, you don't get over this, but you can't process it. So for me, when you said talking about this is what maybe hopefully gives an example to other individuals to see themselves in these individuals who are sharing, and then thereby be more compelled to share and let that weight off their chest and somehow find solace or peace if that's possible. But what about you? Kind of going even deeper. What about yourself? Undoubtedly, I feel like there must have been one moment that reminded you why this work is important, moment when you went away from it and realized you yourself kind of found yourself needing some of these services.
Yeah, absolutely. Well, first and foremost, I want to say I'm very sorry for the loss of your brother and how that also probably affected you. And when we think about equity, of well-being or accessibility to well-being. Obviously, your mother of a certain heritage, ethnicity, age, might have a different perspective or approach to wellness or or not, or completely resented, rejected because it was not something that she maybe was exposed to or ever experienced earlier, which goes back to our earlier conversation about generation or generativity and how we approach certain aspects of a workforce culture. But the same thing goes for you. So you had the exact same loss, but you experienced it differently, which is what's so unique about wellness. It's not a one size fits all approach. It must be individualized and it's a unique experience. So how can you create programming and approach that enables difference of and diversity to be held in the same manner, but that isn't just standardized, if you will. It's how can we make sure that you processing your experience of your brother's loss gets to the same core of how to take better care of yourself through that experience so that one day you can get to a place of no longer feeling complex or what we would say in terms of grief is complicated grief. So I just want to say and use that example. You both had your own separate experiences around the exact same uh, uh, unfortunate loss. But wellness is meant to meet you where you're at, and we have to help the individual feel safe and comfortable enough to even meet themselves to want wellness or to be open to it. And what I will say is often what we've seen at NYC Health and Hospitals and in greater wellness programming that's working is that even if someone of your mother's age and ethnicity uses wellness service at some point, it becomes a social contagion because she might one day say, "Wow, that conversation did help me." Um, and so it gives what you were just talking about, that permission allowance, and it models it for others. But you've now asked me multiple times, and it's not that I'm avoiding it at all, I promise, about what really called me to this work or how I have potentially even needed this work, and maybe that's what inspired me to do so. And the answer is I'm not great at practicing what I preach. And at some point in time, I was the most unwell chief wellness officer that ever existed. And I'm happy to share my scars and I'm happy to share my learning lessons through those experiences because I have survived it. I continue to cope through it. And therefore, I can share my story with others, which can help heal them or help them understand what might heal them and inspire or motivate them. To continue to want to survive, to one day hopefully thrive. So I am passionate about this work because I was severely bullied as a child. I am a out and loud, proud gay man, but I've always been quite readable, if you will. And in a day and age when I was born, where there was no representation out there really on television or even really being talked about that much in pop culture or even society, without it being associated to being a sin or mental illness or attributed to HIV/AIDS to further fear monger my community. I was wildly bullied to the point where I had really consistently thought of taking my own life. And this is not an uncommon story, which is why the youth that are part of the LGBTQIA plus community, specifically trans youth, specifically gay and lesbian youth, um, have a much higher statistic of death by suicide. It's not just about bullying. It's not just about not having representation because that has really changed throughout the years. It's about belongingness. And so, what I have really strived for is to help everyone feel as though they belong, that they matter, that they deserve respect and love and care, and that they then get to in turn pay that forward to really create what I believed healthcare was supposed to be all about, which was humanity. And how I survived was realizing that I could use my voice for good to help anyone that might experience what I have gone through to not experience it. I often try to provide someone as the leader that I am, the manager that I am, the person that I am in my own social circles to provide people with things that I never received or that I never got. Um, and so that's what really has made me want to come to NYC Health and Hospitals and grow my voice in this system to enable me to be able to have decision-making abilities and to be able to corral the coalition for community decision-making around what we want as a culture at NYC Health and Hospitals, but based upon the compassion I talked about earlier, but truly based upon how do we leave our world, our projects, our teams, and people better than we found them? And how do we provide them the things that they deserve that maybe they have not had access to or experience with before? And so I want everyone to know that they have a place to belong at NYC Health and Hospitals. I want everyone to know that they have a gift, a strength, a talent that can make a difference in the life of another. And that if we all truly choose to just be kind and generous and open and to allow people to exist the way they are without judgment, without putting them down, that ultimately that helps everything flourish, including projects and teams and healthcare delivery systems.
I want to get into the facet maybe of leadership. Having all this past history of bullying, and thank you for sharing that. Really appreciate it. Again, that's takes a lot of courage, and world can use a lot more of this. It's putting the stories out there for other people to hear and to identify with, because I'm sure there are many stories that need to be shared. And this just shows what you're compassionate for. What's your driver? But I'm curious, for the perspective of leadership, how has your leadership been informed by this knowledge that other individuals, and specifically people on the team that you manage, teams that you lead, they're bringing their own past, their own trauma? How has that informed your leadership in that sense?
Yeah, absolutely. Well, I think we have to check ourselves before we wreck ourselves or wreck anything that we're going to be engaging in, including people and projects. And so you mentioned before, like, do I practice what I preach, but in different words? And I told you that I don't or haven't. And, I want to remind other leaders of what I've learned is that I'm still a work in progress, that it's always a process. And it's so easy to lose sight of oneself. It's so easy to continue to focus on others because it's scary to focus on yourself. There have been many times where my psychological defense mechanism is to, again, just prioritize other people. A, because that was how I was raised. B, because I perpetuated that own experience of existence that I must always serve others before I serve myself. But at some point, I learned that that actually can stop me from my destiny or my purpose or greater meaning in life, that my legacy of helping heal others and support others and to provide them with the grace and dignity that they deserve to see that their life matters and that they could do something good with it. Um, if I'm not putting myself first, I'm actually, in a way, selfishly stopping myself from my own greater opportunities to change the world, if you will. So my practicing of what I preach has informed my leadership, and I'll give you an example in a moment. So I've learned that as a leader, the more I actually share without trauma dumping, without burdening someone with my experience where now they feel they have to fix me or save me, um, but to show them that I can continue, that I am also not perfect, that I make mistakes, that I can be knocked down, but that I can get back up and I can brush my shoulders off eventually if I learn from those experiences. I've learned that as a leader, if I share more about that, then my team begins to share more. Other leaders begin to share more. I am consistently sharing that back in 2021, I completely lost sight of myself. I was going all around New York City's 5 boroughs at NYC Health and Hospital services across service lines, touting and promoting wellness, teaching others how to be stewards of it, champions or cheerleaders of it, to truly be accountable to it as role models and leaders. And I was not taking care of myself. Um, and when I say I lost myself, I almost quit this job.
Wow.
I took myself away from this experience of what I loved so much because I was so burnt out. I saw the signs and symptoms of burnout. I was too afraid to admit it to myself. And I was not brave enough at that time because I was not ready to address it. But what I can say is that I was saved actually by one of my staff members because they asked me a quick and simple question. What color was I on the stress continuum model that I learned through the US Department of Defense and brought to this system? So by teaching others the tool, by paying it forward, one day someone paid it back to me and I had to face myself to my own staff member because I had asked them that same question the week prior, and they were able to meet their own need, and we provided them with services that they needed, which was to accommodate them to cope through their stress in a way that enabled them to heal, so they could continue to work. And so yeah, in 2021, I was really not taking care of myself physically, emotionally, um, especially mentally. Um, Socially, I really, really fell off the wagon of any healthy behavior.
I find it perplexing. I just want to make sure I get it across before I forget. Find it perplexing how individuals like yourself as an example doing great work, helping so many people, but not being able to mirror that inwardly. There's an example instructions on a flight for the mask. I'm sure you heard it. Like you put on a mask on yourself.
Never heard this ever. We never.
Right. It's like we were taught this: take care of yourself, self-care, but it's very hard to implement. I've heard this great saying, like, if we can't love ourselves, how are we going to love somebody else? Or kind of you can transfer it to how are we going to help somebody else if we're unable to help ourselves? That's always perplexing.
So I'm not sure if you watch RuPaul's Drag Race, but that is how they tend to end each episode.
And that's where I got it from.
Um, and of course, the airplane, discussion always comes up, and I do think it's a good one. I think at times people think it's trite or overused or, but it's true. I think it has been imposed upon us and indoctrinated that if we put ourselves first, we are selfish. And we still have a long way to go within ourselves, within our social structures, within systemic practices of organizations to say that it is okay to prioritize yourself. It is okay to do self-care because when you do, similar to what I just said before, it enables you to do greater work for others, especially healthcare workers. Often what I ask people in our system and nationally and internationally when speaking is who comes first in healthcare. And we, of course, always say the patient, the community members. That's also part of the great mission of New York City Health and Hospitals, which is care for New York City, period, no exceptions, period. They're at the top of our strategic priorities. But if we don't have healthcare workers to keep lights on, patients being transported to the operating room, clinicians and non-clinicians as treatment teams surrounding that individual to ensure that they receive the appropriate care at the right time with high quality, safe standards, then we don't have healthcare. So in a way, I'm saying healthcare workers have to come first. And when we do that, it enables us to lean into our greater purpose and our mission. It helps us remember why we chose healthcare, what we love about helping others, which further has literature that backs it, that we will be prouder of our work, which means we will invest in it more in terms of making the quality better, the safety better, and the satisfactory experience of compassion, empathy, and healthcare felt more, which ultimately impacts the patient experience. So by actually putting ourselves first, we are putting the patients first. So it's a cycle. It doesn't have to be linear. It doesn't have to be point for point. And why do we have to choose ourselves over others? If we put ourselves first to make sure that I have all the tools and resources I need to be the healthiest version of myself to take care of myself, I can take better care of my team and better care of my work, which ultimately only takes better care of the system to take better care of patients. So put us first. Say it's okay to be okay or not be okay, and to make sure that I realize I matter the most. Because when I matter the most, I'm going to work harder for what matters to me.
Exactly. I couldn't agree more. If I can try to build upon what you just said, like, I don't know if you ever, how familiar you are with Alan Watts. I love Alan Watts' Eastern philosophy interpretation. He talks about how some things are two sides of the same coin. So we're talking about wellness. Well, I can think wellness and there's unwellness, if I may kind of awkwardly phrase that, but it's not that these two things are separate. If there is wellness, there's naturally is going to be unwellness. Now it's about maintaining the balance. Sometimes you're going to be well, hopefully, but at certain times you will get down to that period of unwellness, but you have to correct and you kind of go back and forth. And to me, it does not sound selfish to take care of ourselves, because I think you have to get beyond that discomfort, that awkwardness, taking care of ourselves in the holistic sense. I think you said that word, holistic sense, taking care of each other. But if I can transition kind of to the past, and something tells me probably you were not in childhood thinking you will be a chief wellness officer, but what did you want to be? I know you were a clinician, creative art therapist. How did you come to that path that took you ultimately where you are now?
Well, a few things. To answer your first question, no, I never thought I would be where I am today. I don't even think Chief Wellness Officer was a title or even a function in most organizations as I was growing up and seeking higher education. I am still a clinician. I still practice clinically because I never want to lose sight of my deeper mission of creating population health and community health. Um, and that informs also my clinical experience of looking at a presenting problem to try to quote unquote diagnose some of the root causes to then come up through my assessment analysis specific interventions to improve the health outcome of whatever is in front of me. I apply that as from an individual lens as a licensed psychotherapist in the state of New York, but to my systems change organizational strategies. So all of my prior experiences have really just built on themselves. When I was in the fifth grade and I had a fifth grade career report, I remember saying I wanted to be a famous actor. And then from that dream, I wanted to be a talk show host, and I've always wanted to be a talk show host. Um, and this is well before podcasts, so congratulations. Um,
Thank you.
and then it was from there that I continued to pursue acting. It turned into musical theater performance. In musical theater, it is a very tough life, and I came to New York City, the heart of that with Broadway, and I lived the tough actor life, which was often working in service industry or retail. So I, at one point was a general manager of a music store when we had brick and mortar music stores. I then moved into food and beverage and then became training directors and then managers at bars and restaurants. Um, and then I became a life coach. I still do executive coaching. Um, and then that brought me to realize that I was faced with something I couldn't put my finger on because I didn't have the education, and education always scared me because of the severe bullying. I was a terrible student because school was an unsafe environment for me. And but then I realized I could go back to school and find something I love and find like-minded individuals that care for the same causes that I do. And so then I became a licensed clinician, and then that's what brought me to NYC Health Hospitals as a frontline clinician, working psychiatric inpatient service specifically for adolescent populations. Um, and it just grew from there. So I think to kind of get back to your question, no, I never thought I would be here, but I knew that I had something deep inside of me that I wanted to share. I believed that there was a light in me that I could shine. To hopefully one day motivate and inspire others to keep going. And that's um, theater taught me improvisational skills, taught me yes and how to step into any room and to engage an audience. Um, Retail taught me about customer service values. Food and beverage taught me humility and how to humble myself and how to serve others in a different way than being a life executive and career coach did, and then becoming a licensed creative arts therapist. All of this compounded on itself and culminated to me becoming who I am today and how I look at the world and how I approach people. So, no, I didn't know where I would be today, but every inch of what I learned has really informed the next chapter, which now has brought me to this one. But I think what got me to where I am today in all of those different aspects of my life was that I knew that I had something greater than myself that I could apply myself to and that I could take pride in. No. I believe everyone's a leader, situationally, hierarchically, in terms of functional or human resource title. I believe everyone's a leader. It's just how do you lead in a way that builds consensus and camaraderie, cohesion, and community. Um, Everyone has an opportunity to be a leader every single day of their life. Um, so it depends on how you define it and how and where you apply it. I never expected myself to climb the ladder. In fact, that's never been my goal. I didn't want to be a climber. I never want to climb over someone else. But I greatly respect the shoulders that I've stood on, and my predecessors. I had a lot of people that took chances on me and that were willing to. They might have cracked the door, but I kicked it wide open. I just always believed that if I saw something, I could say it, and people were eventually willing to listen. And if they weren't willing to listen, I had to learn how I could communicate it differently or make it more tangible or visible, or something to be able to approach that might one day have it heard. And so I believe that even though I did not aspire to be an executive at NYC Health and Hospitals, that what I did do was help us challenge the status quo, see that difference or change, although it is hard, is possible, and that we could all continue to strive for something better together.
Great. What do you feel people misunderstand maybe about wellness at work and the work that you do?
I think people think wellness is fluffy, that it's us holding hands, skipping down the hallway. Um, I believe we have to demystify what wellness is by reminding everyone that they define it for themselves, but give them framework to realize that they have something to bounce themselves off of or to greater understand in terms of framework, or tools or resource approaches. You know, at NYC Health and Hospitals, we subscribe to the 8 dimensions of well-being. Um, and holistic wellness is the goal here, to make conscious decisions towards a flourishing lifestyle despite adversity, both personally and professionally. A lot of people didn't know the 8 dimensions of wellness and often would think holistic sounded, wonky. Wellness can be a strategic quality improvement imperative that we approach with data informed decision making to really understand how to impact the outcomes we're looking for, such as stress, feelings of sadness or being depressed, anxiety, compassion fatigue, burnout, and the like. Wellness is something that you can improve upon over time using performance improvement or PDSA, or model for change improvement approaches. Wellness is not just looking well or being well. It is a process that we can encourage, through programming. I think some of the you know things that we need to demystify in terms of wellness is that it can be for everyone, but independently and individually. Um, and that there are certain approaches that you can use an equity lens for, so that maybe that baby boomer might be more interested in engaging with it, so that it can be strategic in its design to create more comfort where there might not be any. Um, those are some things that just come to mind.
Yeah, I appreciate that. It hits close to heart. You know, I like the word holistic. You mentioned diversity. It's just, I think to me, this is a reflection of diversity of the people, city of New York. And I think if, you know, and the reason I say this, you mentioned the 8 dimensions of well-being. You mentioned the color wheel that you got from the Department of Defense. So I'm like, oh, you're picking things from other areas that are not necessarily connected to healthcare, but you can find other things outside of healthcare, bring them in, and they would be very applicable and useful in the setting. So I really, really like that approach. What story that you never had a chance to tell about yourself or anything really very open that you maybe find this would be a good platform to share?
It's something I've been doing a lot of lately. I mentioned when I was much younger, trying to sort through my sexual orientation and where I might feel included or that I could belong or be seen as a human being, that I had considered taking my own life. And, May is Mental Health Awareness Month. And I talked much earlier in our discussion today about the death by suicide rate, specifically for physicians, but other advanced practice providers and so on and so forth. I've been sharing my story of hopelessness and helplessness. I've been sharing my story of the moments where I could not cope or didn't realize I was not coping. Um, and I talked during May's system-wide webinar where we had Dr. Tia Dole, who is the federal 988 Lifeline officer, um, who's an incredible human being and doing something fantastic for this nation. I'm trying to highlight that you can be down and out, but it doesn't have to mean it's over, and that whatever's happening in this moment will pass. And so I'm trying to share more of those moments where I couldn't see myself out of my own experience or chose not to, and where at times I chose to potentially remove myself not only from my job, not only from certain relationships in my life or certain circumstances or experiences, but that I've almost removed myself from this earth multiple times. And people are all of a sudden like, "Are you okay, Jeremy?" There's a difference between suicidal ideation and suicidal behavior. There's a difference between the behaviors of also having intent to execute with a concrete plan, with the ability to do so, versus the spectrum that is this idea of what's worth living for. And so the more I'm talking about my true moments, um, of where I have struggled the most, has been really, really interesting to witness. And it's only recent since this past May. I have more people checking in on me. I have more people talking to me differently, in more of a personal manner, not only asking me personal questions, but sharing personal aspects of themselves. So I will reiterate the stories that I've been sharing, that there have been times when I have not wanted to exist. There have been times when I thought about self-harm or self-injury. There have been times when I have lost myself. And as I mentioned earlier, where I took myself away from myself even further. And so the story I want to share is I, for the first time in my life, when going through some true struggle and strife, am asking for help. And just sometimes even sharing my own story is a way to call attention to asking for help. And it's not asking for someone to save me or fix me. It's asking someone to just listen to me, to acknowledge me and my experience, and to realize that what I'm going through, others are as well. So it just levels the human existence. It creates the human experience that we're all a part of, and it can help save lives. It can help someone feel more comfortable, and it might help them realize that even help can look different in different aspects of your life, and that potentially could inspire someone to continue to be the good human being they are and to do the great work that they're doing that could make great difference in the life of another. So I don't have a specific story other than right now in my life, I'm sharing more of actually who I am, how I'm feeling, even on bad days, still doing good work that I'm proud of, sometimes having a struggle bus moment, but that I can continue, and that how I'm continuing is by calling greater attention to it so others can walk alongside of me, and that ultimately that inspires them to do the same, which is what creates community and is what creates belongingness, and that is what creates wellness for all.
Thank you. Thank you so much, Jeremy. Thank you for being vulnerable and being so open. I completely agree. And I think this is something that in my conversation with Carlos, who has brought us together in this conversation, we discovered, if simple act of sharing is maybe cathartic, but also helpful in that small sense of just, as you said, getting it off your chest, you're able to identify with somebody else. You realize you're not alone. And that somehow, in some sense, maybe at the first step to becoming better in that realization that you're not alone, that you're not alone in experiencing this. And people do get past this. Of course, some go in a different means of not, but the hope is to spread this message so that more people can hear this and get on that road to recovery. I myself, I feel emboldened to share. Yeah, I've, you know, had suicidal ideation in the past. When you have these moments and you think, if the window opened a little more at work, I might, and that's important even to share to I guess somebody else who I don't really know where exactly I want to go with this, but I find somehow this kind of touches on a deep sense here right now, because again, I'm identifying, and my hope is somebody else will hear this and will also know they're not alone, and that will uh, make him in a better place.
Well, I
Again,
want to say greatly respect and honor what you just said and the courageousness it took to share that story with me. And the thing I'll say is everyone deserves ventilation and validation, and then that ultimately can create a greater sense of value, not only within one person's life as they see themselves, but in the life of another. And I greatly appreciate this opportunity to speak with you today. I hope this makes a difference in at least one person's life. And if that's the case, then we have succeeded today. You matter, your voice matters, and your life matters, and you're not alone. And people are always there if you will allow. But first, we allow ourselves to be seen and heard. And so I appreciate what you just modeled.
so Jeremy, thank you for sharing your perspective. Thank you for being here. Thank you for speaking not just on wellness system, organizational wellness, but what it means to lead from a place of care. Before we wrap up, where can listeners find you, connect with you, the work that you do in wellness and healthcare leadership?
You can connect with me on LinkedIn.
That's a great place, folks. Go ahead and do that. I will have those notes, links in the show notes in the description. So, folks, if something in this conversation spoke to you, if it helped you rethink what your strength or support can look like, go ahead, connect with Jeremy on LinkedIn. Let him know that it landed. If this episode gave you something worth sitting with, share it forward. That's how we build conversations that matter. And until next time, continue to push yourself.